Half a day, my friends and family. For the past 50 years, our island's only public hospital has faithfully served our local and regional community. This is a service that we, as a people, have supported because, as I believe, it is deeply rooted in our Chamorro spirit of Aguaiza, to love one another as we love ourselves, and Adahi, to take care for one another, to watch over and to help one another. And the Guam Memorial Hospital has continued to provide health care for us for decades, regardless of income, health care coverage, one's religion, and even citizenship. Unfortunately, because of situations beyond our control, the Guam Memorial Hospital is unable to fully recover monies owed for services rendered. And this has left the Guam Memorial Hospital operating at an annual operational cash shortfall of up to $50 million, despite continued financial assistance beyond appropriated levels. Last December, I asserted my Organic Act authority to avert a shutdown and bring stability to a hospital that was both in a financial and leadership crisis. For 6 months now, my administration has been working closely with hospital staff, and together they examined hospital policy and operations and developed a set of recommendations that address some of the challenges and areas of weaknesses at the hospital. Together, we have saved the hospital about $5 million a year. And we also emerged with a plan that identifies internal revenue-generating strategies. Now, unfortunately, these efforts are not enough to lift the Guam Memorial Hospital out of the financial quagmire that it continues to sink into. And this situation prevents our hospital from upgrading its technology and equipment and properly maintaining or even improving the facility itself. We must do more to ensure our region's only public hospital can continue to provide quality healthcare services. Now, to accomplish this, the Guam Memorial Hospital needs your help. This week, we will introduce legislation that requests the Guam legislature to authorize the government to seek additional bond funding that will, number one, eliminate the hospital's nearly $30 million in vendor payables so that they can continue to purchase medicine and supplies. Number two, invest in building upgrades, improvements in technology and human resources so that they can build on the momentum to generate revenue and provide services. Three, it will help us establish a new employees' health insurance fund, which would be designed to assist businesses that currently cannot afford to provide health insurance to their employees. This will mean more Guam residents have health insurance and put quality health care and preventative health care within reach. It also means that when these folks go to the Guam Memorial Hospital, that they'll have the ability to pay for the care that they receive. Lastly, the bill calls for the Guam legislature to enact revenue-generating initiatives that will provide a stream of revenue to sustain the hospital moving forward. I don't think anyone questions the value of the hospital and the fine work that our doctors, nurses, technicians, clerks, and everyone else performs day in and day out. They need our help so that the hospital can transform into a financially stable institution. We need to invest in our hospital to ensure that it is around to help our people for decades to come. The bill that we are giving the legislature aims to do just that. As your governor, it is my moral and fiduciary responsibility to ensure that the hospital is financially solvent. And I remain committed to working with senators and the people of Guam to find a permanent solution so that the Guam Memorial Hospital, our hospital, can continue to provide quality health care for generations to come.